Hello everyone, my name is Dr. Fial from Zoe Royal Hospital and Fertility Center. We are talking about gonorrhea. Gonorrhea is a sexually transmitted infection that is caused by a bacteria. It is a sexually transmitted infection that is caused by a bacteria. And you can get it through sexual contact with an infected person. Gonorrhea is a condition that has many complications. When it comes to infertility, if a woman has gonorrhea and it is not detected early and treated, it can lead to pelvic inflammatory disease, and that can block the tubes. For men, if he has gonorrhea and it is not well treated, it can lead to damages to the testicles. Eventually, it will affect sperm production and cause problems with fertility in men. And so when gonorrhea is contracted in a person and it's not detected early and treated, it can cause fertility problems. Aside that, in men, when you have gonorrhea and it is not well treated, sometimes it can damage the urethra or the tube that carries urine out, leading to what we call stricture. When you say stricture, it means that the tube gets narrowed or closed. And when that happens, that can make it difficult for you to be able to pass urine, unless maybe they put a catheter or something. And so it has so many complications. For men, again, it can even affect the prostate, causing prostatitis. And so gonorrhea is a condition we need to talk about and find out what are the signs and symptoms of gonorrhea when one has that infection. The first thing you notice about gonorrhea when you have it, normally, is that it's a few days after sexual intercourse, sometimes 2 or 3 days, you start to notice burning sensation when you are passing urine. For men. For women, there can be burning sensation, but sometimes the burning sensation is not there. The other thing with gonorrhea is that you see discharge coming from the genitals. If it is the man, you see discharge, sometimes whitish, yellowish discharge that comes from the penis. And sometimes when you remove your pants, it has stained the pants. So we have vaginal discharge also in women as well. And then there is pain in the lower abdomen. Sometimes in some situations, you may see blood when you pass urine. You see that blood comes out and all that. And so it's a very, it's a condition that is quite complex. For men, sometimes when you get gonorrhea, it can affect the testicles and cause pain in the testicles as well. It can cause pain in the testicles. When the infection comes, you tend to have frequent urination. You want to pass urine in smaller bits, but frequently you feel like passing urine, and then you are passing urine. Then sometimes you have difficulty when you are trying to pass urine. So when you notice that shortly after intercourse, some few days after intercourse, you start to notice some pain when you are passing urine, or you have some discharge from your penis, or some vaginal discharge that is abnormal in nature. Maybe the smell is offensive, or the color is whitish yellow and all that, and you have pain in the lower abdomen. You need to find out, and an investigation will be done to find out if it is the infection, so that once they notice that it is a gonorrhea infection, it can be promptly treated to avoid the complications that come with it. So like I said, the complications are quite troublesome. Problems with infertility, problems with urination. Sometimes for men, it can lead to stricture, urethral stricture, where you will not be able to pass urine unless a catheter is placed in your penis. And so it's very important that we notice some of these things and treat it accordingly. For women, it can lead to blockage of the fallopian tubes. The tubes can be blocked if it is not well treated. So it's an infection that you contract from through intercourse with an infected person. You can easily contract it. So when you notice some of these things, it's important you report it, and then treatment can be given to you. Thank you. My name is Dr. Fiao from Zoe Royal Hospital and Fertility Center.